If you have been in an accident which warrants a trip to our urgent and emergency care centre, then you will arrive via your own transport or by ambulance. After registering at reception, you will be seen initially by a nurse and/or a doctor in the urgent and emergency care centre. You will then be referred to the on-call trauma and orthopaedic doctor or advanced clinical practitioner. If you need admitting as an inpatient, you will be transferred to the acute surgical unit or the orthopaedic trauma ward. Every morning, we hold a trauma conference on the orthopaedic trauma ward. This is attended by all orthopaedic consultants, doctors, advanced clinical practitioners, senior nurses, and the therapy team. All cases from the previous 24 hours are discussed and plans made for the treatment pathways. After the trauma conference, the consultant on call will lead a ward round to see all patients admitted in the previous 24 hours. If you require an operation, you will complete a consent form and be prepared for surgery on the ward. From theatre reception, you'll be taken to the anaesthetic room. The anaesthetist will administer the anaesthetic. The type of anaesthetic will depend on the procedure, and the anaesthetist will have already discussed this with you. There may be a number of people in this room, including nurses, student nurses, and junior medical colleagues. Once anaesthetised, you'll be wheeled through to the theatre. A screen will separate you from the operating side of the theatre. The anaesthetist will be by your side throughout the procedure. Once the procedure is complete, you will be wheeled into theatre recovery, where you will be cared for one-to-one by a theatre recovery nurse. They will ensure that your observations are within acceptable levels before they return you to the day surgery unit or inpatient ward. You will be taken to the ward by a nurse or theatre porter. When you return to the day surgery unit or inpatient ward, the theatre nurse will give a verbal handover of your procedure to the ward nurse. In most cases, you will need to be assessed by one of our therapy team in order to be deemed safe for discharge. Once you are deemed safe for discharge, you are free to leave the department. Where possible, we encourage patients to arrange for a friend or family member to come and collect them. Where necessary, patients will have a follow-up appointment with a consultant or registrar in our fracture clinic.